Welcome again to our lecture series at EEE. This is our third lecture in the fall. Beautiful weather. So far it's 3 for 3. Today we have a talk on Howard Center, and we have two presenters. We have Denise Vignoe and we have Charlotte McCorkel. Charlotte is the Senior Director of Client Services at Howard Center, where she supports key programs and works on agency-wide clinical initiatives and quality improvement projects. She was instrumental in creating First Call for Chittenden County in 2016, the Access and Intake Team in 2018, and more recently, the new Mental Health Urgent Care Program at 1 South Prospect Street in Burlington, a walk-in crisis clinic for adults. Charlotte has been with Howard Center since 2008 in various leadership positions. She is on the Board of Trustees for Home Health and Hospice and has been an adjunct lecturer in the social work department at UVM. She lives in Burlington with her family and enjoys spending time in Vermont's beautiful outdoors, just like we all do. And Denise has lived and worked in Chittenden County for nearly 30 years after graduating from the University of Vermont. She has had a wonderful and varied career path working in nonprofit administration, sporting event management, and in business. For the last decade, Denise has worked in development and communications at Howard Center. She is passionate about the organization's mission and enjoys helping people better understand its critical work. Over the past decade, she and her team have hosted over 80 community education and fundraising events. Denise has served on several boards and board committees, including the Boys and Girls Club, Samara Foundation of Vermont, Lund, and Community Health Centers. Please welcome Denise and Charlotte.
Well, good afternoon, and thank you for that very kind introduction. Charlotte and I are really delighted to be here and to learn about this wonderful organization. We're going to probably be popping in from time to time. What I'm going to be doing, there is a little bit of feedback. What I'm going to be doing is a brief organizational overview. I'm going to share some numbers, some history, a little bit about our mission, and then Charlotte will come up and she's going to talk about the heart of our organization, and that is serving people in our programs. So let me step back and say, and then you will get to hear about the good things that happen in the organization every day. Howard Center is a wonderful organization. I know we both feel really proud to walk in the doors every day. For folks here in person, how many people have heard of us? Raise your hand. Great. Okay. Well, I hope you're going to learn a little bit more about us. So we do have a slide deck. We are part of Vermont's system of care, which there are 16 organizations that serve various regions throughout the state. We're the largest provider in the state, and we serve Chittenden County. Okay, there we go. We're a mission-driven organization, a community cornerstone, and we're really important to the healthcare ecosystem here in our community. We're truly embedded in the fabric of our community, and I think you'll see that as Charlotte talks more about our programs. Our mission is to help people in communities thrive by providing mental health, substance use, and developmental disability services. And I think I told Mary Ellen, if there was one thing that she walked away with today, it was to learn those three things. We're a large, complex organization, and people often tell us that they have difficulty understanding what we do, but we provide mental health, substance use, and developmental disability services. We provide care across the lifespan, so we support people young and old and across all walks of life. We are deeply mission, vision, and values driven, focused, and our clients are absolutely at the heart of everything we do. We have a long and rich history, and this year we're celebrating 160 years of service. That's a long time to be in the community. We began in 1865 serving widows and orphans of the Civil War. Does anyone know where this is? This is the Home for Destitute Children, which sat where Price Chopper is on Shelburne Road now. along Home Avenue, the namesake. For those of you interested in history, Dr. Megan Cope, a researcher at the University of Vermont, has done some amazing work around the Home for Destitute Children in her Mapping American Childhood project. And you can find a link on our website or, of course, at the University of Vermont website. We also do have a special collection at the University of Vermont Library. They curate that for us. There's a lot of historical information, photos, logbooks, annual reports. It's remarkable to look back through history. Just a few more highlights, and then a few more. Ooh. How's this? Travis, how's that? Is that good? Okay. A few more history highlights. We're named after the Howards, John Purple and his sister Louisa Howard. They were early benefactors in Burlington in the late 1800s. You may know the Howard Opera House, which they provided to the city. That's on Bank and Church Street. It's still standing. They made renovations to the beautiful old mill on UVM campus, one of my favorite buildings in Burlington, and the Louisa Howard Chapel in Lakeview Cemetery on North Avenue. They also made many gifts, unfortunately, that are no longer with us, but they're important to our history. Fast forward, I'm going to keep leaving this slide up while I'm on history, but fast forward to 1963, and the Federal Community Mental Health Act was passed. And so that provided landmark legislation that's really important to our organization. We provide community-based services, and that helped to reform mental health care so that people are receiving services in their home communities, and they're no longer living in institutions. This was also the year, 1963, that the Vermont Department of Mental Health was formed. Moving ahead to the 90s, there was a significant occurrence that really helps to explain Howard Center's growth and size. So in 1994, 3 organizations in Burlington merged. Does anyone have any inkling about what those 3 organizations were? It was designed to improve and expand care, to take advantage of operational efficiencies, and to take advantage of one another's boards. Champlain Drug and Alcohol Services, Baird Center for Children and Families, and Howard Center for Human Services. Now, Howard Center has had many names throughout the years. That was another one. We are now just simply known as Howard Center. There's much more to our history than those few highlights. What I do want to say is that over the many, many years that we've been providing services, we have adapted and evolved and changed to meet the emerging needs of our community. Charlotte will talk a little bit about some of our programs like street outreach and community outreach, which are indeed just that. We've opened programs, we've closed programs, and I am sure for the next 160 years we'll continue to do that all throughout time. Now, moving on just to a few of our overarching numbers. On the screen, on the left-hand side of your screen, you're going to see the Vermont. Chittenden County, about 26% of the population lives in Chittenden County. We have 1,300 wonderful staff who help people in over 50 programs and in 60 locations across the county. We do provide services in 4 counties currently, and we touch about 19,000 people each year. It's a lot of folks. So the next slide, this slide are just some additional numbers. Let me review some of them with you. We are the 5th largest employer in Chittenden County. We're the 11th largest employer in Vermont. We provide round-the-clock care in our residential programs and on our crisis hotline, First Call for Chittenden County. We have about 200 shared living providers, so those are families and individuals who have opened their home to someone. We operate about 25 of our own residential homes, and we operate 3 independent schools, Baird School in Burlington, Jean Garvin School in Williston, and Fay Honey Knopp Memorial School in Rutland. I think that's all I wanted to say about that slide. I'll leave this up just for a moment so you can take it in. These are the types of services that we provide and the number of folks that we're helping in those areas. Also, just so you understand, and I think you'll glean this from Charlotte's talk, but beyond all of the numbers and things I've mentioned about these slides, we're much more robust. We have outpatient services for children, adults, and families. We have a full spectrum of substance use services, and we have a wide array of developmental disability services. Next slide. This is just a look at, on the left, the county, and there's the town breakdown and the number of folks that at one time we were supporting in that community. All of the numbers I'm showing you are from 23 and 24, so we're just right now pulling together all of our numbers from this last fiscal year. And on the right-hand side of this slide is the county and the number of folks that we served in, who lived in those counties. They would have come typically to our area for service. Let's see. And then just a couple of things about our annual budget. So we're $145 million. Oh, something is over that. Let me see there. Can you see it? Okay. So did folks have any understanding that we were that large? That's a pretty significant size. When you think of a lot of other nonprofits, you know, they might be 3 million, 5 million, 10 million. So 90% of that relates to our workforce. 10% is operations, keeping the lights on, keeping the grass mowed, all of that. What else did I want to say about this slide? We're about 95% funded by the state. So that's really important to know. The legislature and state provide funds to us. Your mic is off. Oh, my mic is off? Oh. Okay. How's that? That's much better, isn't it? I'm actually going to just say one more thing, and that is that about 75 to 80 or 85% of the folks we serve are on Medicaid. So that gives you a picture of just folks are typically fairly low income. And I am now going to turn it over to Charlotte.
Thanks, Denise. Can you all hear me?
And then just click.
I got it. So I'm going to talk about our programs, and as Denise said, we're quite large and quite complicated. I've been with Howard Center for almost 18 years in many different roles, and it took me a full 3 years to understand the agency inside and out so I could speak to groups like you about the work we do. And we have just an hour with you. So if you leave here feeling confused, we really understand, and we hope that we'll leave you some key points to remember. One is the phone number you see across the bottom of the slides on every single slide. That's our main number, and if you're not sure who to call or when to call, you can always call that main number and you'll be pointed in the right direction. In the back of the room, we have some print materials that also have that number, so you don't have to remember it right now. Like Denise said, we provide services across our community and across populations, from early childhood work, supporting new parents with their infants and toddlers, all the way through elder care, and every population in between. Besides the type of populations that we serve, we also provide a lot of different services. So we provide services in our many different main sites and Howard Center buildings. Sometimes that looks like outpatient therapy, like you may have experienced yourself, or maybe you've seen on TV or movies, like a person coming to an office and sitting down with a provider and having a back and forth conversation. Sometimes that looks like someone coming in to see a nurse or a medical provider, or participating in a group, or as Denise mentioned, going to school in one of our school programs. Beyond our outpatient, or what we might call our clinic or in-person work in our sites, we also provide services in homes throughout Chittenden County, where we'll do home-based work, meeting families, children, adults in their own environment so that we can support them right where they are and not require them to travel to us. And we provide services in our community. We provide one-on-one support to different populations, and without even knowing it, you may have passed our staff supporting clients in the grocery store, walking down Church Street, maybe going to their own appointments. In addition to those community-based services, we also offer services in partnership with other community providers. So we have Howard Center staff who provide services in the emergency department at UVM Medical Center, or in Cathedral Square in partnership with the services they provide, for example. We also have Howard Center staff in every single public school in Chittenden County. So if there's a service to be provided, Howard Center is likely at least a small part of it. I'm going to talk about some key programs that I feel really excited to share with you, because as Denise noted, either they're new programs or they're really long-standing programs in our community. And all of you today can leave as ambassadors of these programs to spread the word to your neighbors, to your family and friends, and to your own circles so that they can access the services when they're needed. And the first is our newest program, Mental Health Urgent Care, which opened almost exactly a year ago in October 2024. And we have a video to share with you now about Mental Health Urgent Care. Welcome to Mental Health Urgent Care at 1 South Prospect Street in Burlington. We're open Monday through Friday, 9 to 5. We're accessible by bus, and there's free parking here. Mental Health Urgent Care is a program operated by Howard Center in partnership with Pathways Vermont, Community Health Centers, and University of Vermont Medical Center. We're designed to be a place for people to go needing crisis support as an alternative to the emergency department. At Mental Health Urgent Care, you can receive a range of services. Howard Center provides crisis assessment, intervention, safety planning, referrals to different types of services and care management support. Pathways Vermont provides peer specialist support, and Community Health Center has a registered nurse here on site in addition to telehealth medical appointments. Our services are for people 18 and over, and we don't schedule appointments. Rather, we want you to come in anytime in a walk-in capacity. Mental Health Urgent Care is designed to be a place for people to go needing immediate support or feeling like they're in crisis. There are times when someone might feel very overwhelmed or stressed. They might have thoughts about suicide or otherwise hurting themselves. We want them to access this Mental Health Urgent Care program to get the supports and services they need and referrals to other types of services in our community. We know it can be really scary to ask for help or to not know where to turn when you're experiencing any sort of crisis. And so we encourage you to come to Mental Health Urgent Care, and just by walking in the doors, you'll be warmly greeted and provided support and connected to services and treatment. Mental health crisis can mean so many different things to different people, and we want people to feel comfortable coming to Mental Health Urgent Care if it's a crisis to them. That could mean that they're feeling stressed or overwhelmed, they're having symptoms they've never had before, or they don't know where else to turn. If it's a crisis to you, it's a crisis to us, and we want you to come to Mental Health Urgent Care, where we can understand more of what's going on for you, help provide support, and connect you to services in our community. And we're hoping that people feel really comfortable and supported, even just being in our physical space, with views of Lake Champlain, the ability to have natural sunlight, and also really easy access to other types of healthcare services, mental health services, and substance use treatment services right here in this building. It could be that when our guests come in, they receive services here, and then we walk them down the hall and help connect them to other services that may be needed in their stabilization and recovery. Sometimes when someone's in crisis, they don't know where else to go and they end up in the emergency department. And while the emergency department is a great place to be when there's a medical emergency, it can be loud and overwhelming, and it isn't designed to be a therapeutic environment to best support a mental health crisis. That's why we've created Mental Health Urgent Care as an alternative to the emergency department, where it's quiet and calm, and we're hoping to offer a therapeutic, soothing environment to help someone's recovery and healing as soon as they walk in the doors. we're looking to offer people hope that they can feel better and that they have the support and services that they need, and to help them have a plan so they know that follow-up services and treatment is available. Here, someone can access crisis assessment and intervention, and then also connect to a care manager and have referrals to other services in the community, possibly a screening by a registered nurse, and then support from a peer specialist. One partner agency couldn't do it alone, but together we have the power and strength to provide support to anyone who comes through our doors. Our hope in creating mental health urgent care is that people will feel comfortable accessing our services early so they can get preventative care in addition to support, and we can help prevent things from worsening. And by accessing all those different types of services here, we're hoping that someone feels better when they're leaving and also has a sense of hope. Opening the mental health urgent care was one of the highlights of my career so far. And at 1 South Prospect Street, some of you may know that as University Health Center or UHC or the DeGosbrian building. You are welcome to stop by mental health urgent care anytime you're there. Some of you might go for other appointments, mammograms, labs. You're welcome to come up to Arnold's 4. There's a lot of signage to help direct you. And just stop in and say, I just heard about the program and I'm looking to see it. Our staff are really happy to give tours, and it's one of the ways we've been able to spread the word is by having people who are not in crisis, who are just community members who might happen to be in the building, coming to see it and then telling their community about the service we provide. The next video we have is about our outreach services, our mobile outreach services in Franklin, Grand Isle counties.
Hi, my name is Andrew Decker, and I'm the program supervisor for our new mobile unit here in St. Albans. We're an extension of our St. Albans Outpatient Treatment Center and Safe Recovery located in Burlington. We want to offer a harm reduction and low barrier approach to seeking any substance use service and to be able to provide substance use service specifically for people struggling with opioid use addiction. We've identified there to be lots of barriers, especially here in Franklin County and in Grand Isle County, around seeking services and staying engaged in services for the long term. One of those barriers being transportation. We are stationed out of St. Albans, and we are currently offering services in Richford, Vermont, in Swanton, Vermont, and soon to be in Alberg, Vermont. We're a completely walk-in service. We can schedule appointments if that's what is best for somebody. What we are finding with the complicated nature of what substance use is now, people enter recovery at all sorts of different stages, and our first task is to say, what can we do to help you today? And that might include offering overdose prevention supplies, and that means Narcan, test strips, maybe some brief wound care opportunities to address some of those more complex needs. That also could mean some safe use supplies and making sure that we're preventing the spread of communicable diseases such as HIV and hepatitis C, and really trying to just meet a person where they're at. And underneath all of that is just to create a safe relationship where we can chat and just offer any help that that person is looking for that day. When you walk into the mobile unit, you'll find a very clean and organized space ready to help you with whatever your needs are. It's separated into 2 rooms. In the front room that you walk into, we provide case management. That's also where you will find the anonymous overdose prevention supplies and safe use supplies. This is the back room. This is our private medical and counseling room, and this is our fully functioning telehealth monitor here on this wall. We have access to doctors, counselors, case managers, nursing, both on rotations of in-person, having a doctor about once a month be on this unit, and also fully telehealth capabilities with Wi-Fi and power, and direct access to a full team of people who just want to help. On the mobile unit, we have a fully self-sufficient restroom, which allows us to provide point-of-care urine analysis testing, or UAs. We have found that the barrier for some people to drive an hour once, twice a month to provide these testing has been a barrier to stay engaged in treatment for the long term. Through this grant opportunity, which funds this mobile unit, we're able to offer a unique opportunity for folks who are experiencing barriers. They can enroll in one of our grant opportunities if they are seeking Suboxone care. This includes free medical service, no insurance required. It includes free counseling and case management services, and includes incentives for continuing to engage with us and allowing us to help you. The money that's used to fund this program is currently aimed at lowering the barriers around opioid use disorder, but we are noticing that people are struggling with lots of substance use, and we are using this opportunity to also help anybody who's struggling with any substance use. We're working really hard because of the epidemic that happened, and what's happening is there's not the same treatment options for people with cocaine use disorder, and those treatments are less available and less understood by the general public, and it's not as easy as meeting with a doctor and getting a prescription. It's much more counseling and behavioral health oriented. And then the third part of that is all drugs are just becoming adulterated with fentanyl and xylazine, which is upping the addiction properties of these substances, just making, it's no longer just treating one substance, it's now treating 2 or 3 or 4 all at the same time, which comes with its own unique challenges around thinking about what that does to a person and the consequences that that could have for them in their life. Some of the unique opportunities to provide ongoing support to somebody who's been working really hard to navigate those barriers to get to St. Albans, we can now provide support to them in their hometown and to decrease the barriers and the stress of going through treatment or getting help. As a person who's been doing this work for a little while, the thing that still kind of sends chills down my spine is the people who have been seeking services in these programs for 10 years, and all of a sudden they're like, you guys are in Richford? Oh my God, this makes my life so much easier. It was a real hardship to try to get down to St. Albans every day. Some of those stories and connecting with those folks has been truly some of the most heartwarming experiences in my career.
Another service we want to highlight is our outreach programs in Chittenden County. In Burlington, we have a street outreach program that has staff that typically on foot walk around the Church Street Marketplace and respond to other parts of Burlington to support a mental health crisis or any sort of behavioral health, substance use, or social service need. And the street outreach team has existed for quite a number of years in partnership with the Burlington Police and also local merchants and really the whole community, so that when people are in need downtown, street outreach can be a support. This is a picture of our community outreach team, which was developed just a few years ago, and it's kind of a counter to Burlington Street Outreach. So community outreach exists in the towns surrounding Burlington, and they can provide also anywhere in those communities. Sometimes a crisis is in the library or the grocery store or in a parking lot, and our community outreach team can respond either with the police or often instead of the police and provide an intervention and response. The goals of both of our outreach team is to provide that in-the-moment intervention and support so that the police can go on to other parts of their responsibilities, and also so that someone doesn't have to go to the emergency department unnecessarily. And we've seen really amazing outcomes with both of these services in being able to be a response in our community. First Call for Chittenden County is our 24/7 mobile crisis response. This is another number that is great to have in your phones or just handy in case someone's experiencing a mental health crisis. And again, for you, that could be a family member, a neighbor, a community member, someone in your faith-based organization, someone here as part of this group. Our First Call for Chittenden County team provides phone-based support 24/7, and then they also provide mobile outreach. There's a crisis clinician, typically a master's level clinician, and then a peer support specialist who co-respond together and they will go anywhere in Chittenden County that the crisis is. That could be your own living room, it could be again, a parking lot, it could be an office building. They provide intervention and crisis assessment, and then they make referrals to needed services. And if someone might need psychiatric hospitalization or a different type of service to best respond to their need, First Call is the place to call to get that different service or figure out what's needed. It's really hard day to day in our community to talk about mental health. There's so much stigma that exists, and there's a lot of shame and stigma around suicide and self-harm specifically, but that's what First Call is really good at. First Call talks about suicide every single day. Every clinician is trained in suicide intervention, assessment, and prevention, and they're really part of the backbone of our community in addressing stigma, in providing prevention, and in helping keep people safe. Often, the person calling First Call is the person who's needing help themselves, but other times a family member might call, or again, a neighbor might call, and we also get calls from professionals, a therapist, a doctor, a different kind of provider who may be concerned about someone, and they're looking for guidance from First Call and how to, we can point them in the right direction. You may have heard the number 988. This is a new national lifeline number to make it really easy to connect people to mental health services and to crisis response. And part of why it became a national number is because of the prevalence of suicide in our country and the growing rates of suicide deaths and suicide attempts. So the Lifeline was born with the 988 number to make it as easy to call for mental health help as it is easy to call 911 when there's some sort of other emergency. So 988 can be called, again, 24/7, and in Vermont we have 2 different local 988 call centers, and they dispatch people in our own community to respond. So if someone, let's say from here, calls 988, if an in-person response is needed, 988 would talk to the folks at First Call, and First Call would respond. And so it's not some stranger in some other part of our state or country who's responding. It's really the local response that is such at the heart of Vermont. This is a picture of some of our access and intake staff with our multicultural liaisons. And so it used to be when Howard Center had come from different agencies and came together to form Howard Center, there were a number of different intake numbers. But that was too confusing for everyone involved. And so about 8 years ago, a unified main number was created. That's the main intake line. And that's the 488-6000 number you see at the bottom of the slides. If someone's looking for services at Howard Center or in the community, it's that number that we want people to call. And in that phone call, there will be some questions about the nature of what's going on, and then an appointment can be made for a mental health assessment or a screening or in-person support to determine if someone can become a Howard Center client or what other services and supports might be helpful. And a few years ago, with some grant funding, we were able to develop a team of multicultural liaisons specifically to partner with us to respond to our new American and refugee community so that they could be cultural brokers in a way and help with so many of the barriers it takes to access mental health and substance use services. So we're really proud of this access and intake team and the multicultural liaisons. And then we have an adult crisis stabilization program, and this will be our final video for you.
This program is a short-term crisis stabilization program for people experiencing a mental health crisis who might otherwise find themselves going to the emergency room for support. Here we run a 5 to 7 day stabilization program with tons of therapeutic supports, a therapeutic environment for them to stabilize and get on their feet. So we will individualize our treatment and interventions for each person who comes through the door. There are never more than 6 clients in this building, so there is a high degree of individualization that happens. Our backyard, which we really treasure here at Adult Crisis Stabilization, it's a very peaceful place with a gazebo and wildlife and flowers, and it's a place where clients and staff can come to relax. Sometimes groups will gather out here, barbecue, cook dinner together, and it's really a nice space, and it's set away from the traffic and the movement of Burlington, but we're still close enough for everything to be convenient. We are also pretty close to parks, to Oak Ledge Park, to Lake Champlain, and we encourage clients to come with us on walks. People find that comforting and soothing. Welcome to Howard Center's Adult Crisis Stabilization Program. There's a large common area where people can hang out, watch TV, play games, do art projects, anything therapeutic that supports them through their healing process. And they'll do things together like play guitar, play chess. We had a couple of clients recently who were really into chess, and they made that connection together, which is nice. Every client has their own private room. So this is a typical client room. We've chosen the colors on the walls very intentionally, the art on the walls. There's a little welcome basket for every client, and we try to make it feel as comfortable and cozy and homey as possible. When a client stays with us, their clinical team will work with them to set out a specific set of treatment goals for them to focus on while they're here with us. And it is our goal to help them get there. Our space feels very comfortable. It's well lit. It feels a little bit like a home environment, and all of that is intentional, from the paint colors to the lighting. We don't want it to feel like a hospital or a sterile clinical environment. We want it to feel comfortable, cozy, a place where people can really focus on themselves and the goals that they're trying to achieve. Everything is designed to be as therapeutic as possible and to facilitate growth. We are right here in the south end of Burlington on the bus line with easy access to other Howard Center services and also other resources that people need in the community.
Often mental health services are stigmatized as being sterile or institutional or cold in some way, and that's the last thing I think of when I look at the Adult Crisis Stabilization Program. I was there, I spent most of the day there yesterday, and it really is as warm as Cyrus shows in that video. And I think to that end, a lot of what is in mainstream media about mental health isn't good news. It's bad things happening, dramatic headlines, but we at Howard Center and in our community are doing really good work every day, and we're really seeing the results. And we certainly wish that that got more media attention. For every single client we serve through a treatment plan or through our ongoing services, we ask them to complete a client satisfaction survey, and we consistently get very good results. For example, 87% of the clients we serve say the services they received made a difference. And 88% say the services they received were right for me. Of course, we want those numbers to be 100, and we're always engaged in strategic planning and continuing process improvement, quality improvement efforts, so that we can increase those numbers and reach people in new and different ways. But we're really proud of our client outcomes. I'm going to spend a few minutes talking about how Howard Center fits into our Vermont system of care related to mental health, substance use, and developmental services, and then some of our challenges. And then we'll end with some key takeaways. So as Denise said, Howard Center is one of a number of agencies in our Vermont system of care, and we're often advocating, always advocating, for legislative support to increase our rates so that we can best serve Vermonters. It's very difficult for us to have a balanced budget given the complex needs of our clients, and the cost of maintaining our workforce and wanting to be an attractive employer. And so we really need predictable, flexible, and sustainable funding. And right now, most of the funding we receive is to provide treatment or direct services, and we don't have as much funding as we want to or need to be upstream, to be preventative and proactive, and doing more community messaging like this, and doing more training, and in reaching people before they're in crisis or before their symptoms get worse. That's always our goal and always our message, but we wish we could do a lot more of that work. There are other environmental factors like affordable housing is a real struggle for our clients, but it's also a struggle for many of our staff who need to have 2 or 3 jobs, either at Howard Center or even in the community, so that they can afford to live here and work here. Our staff have so many administrative burdens in their clinical documentation and paperwork. And then while we have some programs, like our mental health urgent care program, which received 3 years of full funding, a number of our programs don't have full funding and are perpetually underfunded. As I think was mentioned in the mobile outreach video, the needs in our community have become increasingly complex. It's not typical that we see someone with maybe a simple depression diagnosis, but rather someone with that depression diagnosis who may also be struggling with housing or with substance use or with a complex set of other needs. And even with that complexity, sometimes based on criteria that we have or that the state has based on funding, there are challenges in eligibility criteria and in making sure that we can serve as many people as we want to serve. For a number of our services, clients have to have Medicaid to access them, and there are some people who have commercial insurance or don't have Medicaid who can't access the very needed services. We also have an aging population with complex medical needs, and we're actively working right now with community partners to evolve our care so that we can be prepared to partner to meet those medical needs. So we can't look at one person and think of just one type of service, but we have to think of the whole person and all the different types of services they need, and not just how Howard Center can provide those services, but how we can partner with other agencies. And as Denise mentioned, we're often opening programs, but sometimes we also have to close programs based on our funding or evolving needs in our community. And so we closed some programs in 2023, and we're in the process of closing some programs now as well. One of the things that felt really important about our most recent program closures is that for the clients who were impacted across the board, they could continue to receive services at Howard Center in some form, even though some of their services were changing. And the staff who were impacted were all offered jobs in other parts of the agency, which felt really important as we thought about transitions. As I mentioned, there are some times where families have commercial insurance, and not all commercial insurance carriers pay for all the services we provide. And so we're often thinking about creative programming for that population, or advocating for different types of funding from commercial insurance payers. There's certainly homelessness and economic challenges in our community. And then especially with the impact of COVID-19, we're seeing that school systems are struggling more than ever, and the needs of students are becoming more complex. Sometimes a barrier to services, and this is also a barrier to for some of our staff, are the limited childcare or after-school programming options. And then, as I mentioned, our workforce challenges. And I think these are important to recognize that Howard Center is part of our community ecosystem, that we can't just think about how we provide mental health services, but all these external factors impact not only our clients, but also our staff. At Howard Center, we are chronically challenged with our workforce. And so we have almost 100 positions posted today. We have 1,200 staff who have jobs, but we don't have enough people in Vermont to fill all the jobs that we need. And when we have a job posted, we know that the hospital and other critical players in our community also have similar jobs. So we need to stay competitive as an employer and figure out systemic solutions to making housing affordable and making Vermont an attractive place to be. I think I talked about all of these challenges. I want to certainly end on a high note of hope, and so I think one of that type of hope is in the community education we provide. We have print materials, like I said, in the back of the room here, but those print materials are distributed to every library in Chittenden County, to every doctor's office, to every school, and to community partners as well. We provide suicide prevention trainings in our community at no charge, and we're also a distributor of firearm safety locks in an effort to keep home safe and to keep our community safe. And then at different times, we have education series, like our community education series, where we have different speakers or presenters on a variety of topics that's free and open to the public. At Howard Center, we say all are welcome, and we have hundreds of good things happening every day. We often hear the very generous question, how can I help? And so Denise and I wanted to share these 4 ways, again, for you to remember and then to think about for your own community. And so if you see or know someone in need, please connect them to our services. Stay informed to help reduce stigma. There's so much shame and stigma in accessing services. We really want people to be informed so they can be as comfortable as possible. Advocate for legislative funding and contribute financially if you're able. And for 3 things we want you to leave with today, please know that Howard Center is available in our community 24/7, 365. You don't have to wait for a crisis to call. If you're worried or wondering if you should call, that's the right time. And it's really okay to talk about hard things so that we can partner with you to figure out how to provide support and services. Thank you.
Thank you, Charlotte, and thank you, Charlotte, and Denise. Denise, here's a microphone for you. So now we'd like to open it up for question and answers. If anybody has a question, just raise your hand and we'll give you a microphone. Oh, here's somebody right here.
Of course. I just want to say how proud, is it on? Oh. How proud I am that I was on the, no, I don't think it's on. Oh my God. All right. Okay. There you go. I'm very proud to have served on the Howard Center board for 9 years. And I can tell you that, I mean, this is bringing tears to my eyes because it's all, you know, happening, and that Howard Center is doing things. And I hope people, if they have some time or interest in helping to advocate, can find out by calling the Howard Center and finding out how can they affect the cuts that are coming and may be coming from the state and the federal, legislators, and what can you personally maybe do to be in touch with someone, or if you want to volunteer or to serve on a board or a committee, that's another thing that you could do. And I just want to thank the 2 of you for that was a wow, I think. Thank you very much.
Thank you, Connie.
Thank you, Connie.
One, two. Okay. You talked about public education, and one of the things I scratch my head on for not just the Howard Center, but a wide variety of public education things, is how do you get data to show that your public education outreach is reaching the public?
That's a great question. So sometimes with our community education or our trainings for specific audiences, we're able to give a pre and post survey about demonstrating increased knowledge on a particular topic. We often do evaluation forms for continuing ed, but it's harder for general media campaigns. Like, for example, we're about to have mental health urgent care advertised in WCAX, and it's going to be hard to know how much that impact is. We often participate in a community needs assessment, and sometimes that gives us information from a broad spectrum of people who may not come to something like this or may not go to our community education about their knowledge of Howard Center and their views on different topics related to mental health or substance use. But it's tricky.
There's someone here. Can I give her my mic?
I commend your presentation. My question has to do with, is there a state mental health authority in this state, and which is usually under the governor's office and linked there? And I have the distinct impression, I moved here fairly recently, that Vermont kind of, at the state level, bailed out of mental health services in terms of a locus of authority and coordination of services and leadership, most of all. We've heard recently about the governor getting activated around school systems, but mental health systems seem to be neglected. I wonder if you'd address that.
Thank you. In Vermont, the Agency of Human Services has a Department of Mental Health, and they are the governing body for mental health services in our state. And the Department of Mental Health is what designates community agencies in each county to provide services. It's very different than how other states operate. In most other states, services are provided directly by state employees in communities who are providing those services. That's not the case in Vermont. We have a system where the locus of control is quite different, and local community partners are tasked with providing the services. There are provider manuals and provider agreements so that across the state, services are unified to some degree, but they are provided by different agencies.
I'm interested in hearing more about what you do in the schools. Could you talk a little bit about that?
I'm happy to, and I have an almost 8-year-old, so this is a question that matters to me personally. Howard Center has long-standing relationships with our public school system. We have contracts with public schools to have clinicians, master's level clinicians in the public schools providing therapy sometimes and providing care coordination and case management. And so these are Howard Center clinicians who were co-hired by the school district and by Howard Center to be really embedded in the school community and to be part of the school. There are some very small elementary schools in Chittenden County who might have a Howard Center clinician 1 day a week, and there are some large high schools who have 3 Howard Center clinicians who are there full-time. And they may have a caseload, a list of students who they specifically support based on those students' own struggles, but they also support the whole school community if there's an unexpected crisis or if someone's needing something throughout the school year. And they partner with the school leadership so that there can be mental health trainings and the best mental health response. In addition to our services in those public schools, school districts make referrals for Howard Center services in Howard Center programs like the schools that we run, or for specialized services like for kids who might have an autism spectrum diagnosis or who might need one-on-one intervention in the school or during the school day.
Any more questions over here? Oh, we've got somebody.
I think the hospital and the Hulu organization we heard about last week are both struggling to find housing for their employees. Is there any thought of trying to cooperate with them to see if they can give ideas or help?
Yes, any housing in Vermont is helpful for Howard Center. Some of those hospital employees have spouses or partners who may become Howard Center employees, and so we've definitely seen some mutuality when we share advertising or partner together on recruitment efforts like that.
Kathy, is there any more on Zoom? Any questions? I think one last question here.
Just a quick question. Have you seen, has the hospital seen a drop in mental health crises in the emergency room since you've now opened the urgent care unit?
That is the million-dollar question, and it's so hard to prove cause and effect with emergency department visits. But one thing that the hospital is definitely seeing is some of the people who have ongoing chronic needs who are utilizing the emergency department are now coming to mental health urgent care instead. And so the hospital providers are really noticing that. We are looking at data over time to see whether we can demonstrate a reduction in ED visits for mental health from mental health urgent care, but it will take some time for the data to catch up for us to show that. At mental health urgent care, it doesn't necessarily have to be a one-time visit. We encourage people to come back the next day for additional services, and we have a beautiful community room that has peer support specialists that can support people if they're needing a safe place to be, or they're not sure where else to go, or maybe their go-to way to get help is by going to the emergency department. And so we've had some people come day after day for support at mental health urgent care, and we're really thrilled that they're coming to us instead of the emergency department. Denise and I will both stay to answer questions if anyone wants to talk individually or has a question as they're walking out. And we do have a resource table to your left as you're walking out. And we really hope that you look at those materials and take some to bring back to your own families and communities. Thank you all so much. It's been a pleasure to be with you.
Thank you.
Re-